not enough to go down.
Holding on to some of our thoughts around research, one of the things that's often really interesting around research is it helpful? Like why, that question around why do research, and somebody called Polkinghorne looked very much at how research gets used by practitioners and under responses to research. And he found like 3 different ways of utilising research. And he found that, some practitioners would maybe not even bother reading, kind of researching journals and what have you. So in other words, there's no utilisation of it at all. So it's like it don't impact on me whatsoever. Yeah. So we can talk about responses to research, like with practitioners who have no utilisation of it at all. Okay. There are some it could very well be that a good example of that would be, do you remember the nurses who knew from their own work, they kind of look at the research, remember with the cannula tubes, they'd kind of read it, do it, learn it, and not use it at all because actually it had no impact on their practice. Yeah. In their words, there was a word that we used earlier on around your in-practice judgment. Yeah. And in that case, those nurses would use their in-practice judgment above what the research said. For some people, there may be conceptual utilisation of research. And that might be, for example, that I might go on a course that looks at, the latest findings around trauma. And I may find ways of kind of thinking, I can use a bit of that. Yeah, so my practice will change a little bit. But actually, that's far too treatment orientated for me. That doesn't quite fit in with my practice. Yeah, so that doesn't feel right to use it. So there was some conceptual utilising of it. And then there are some people who will kind of take it all lock, stock and barrel. Yeah, so it's like the research says this, so then that's what they do. Yeah, that's the treatment protocol, that's what I'll do. Yeah, so in other words, there's complete utilisation of research. And that's helpful to think about how I utilise research, like for ourselves, like am I going to be a cynic and actually just not bother with it? Am I going to read it and kind of think, well, that's okay, but it's not my kind of cup of tea? Are we going to kind of look at the benefits or the non-benefits of it, or do we get completely taken over by it? So that can be some responses to research. One of the things that this came out of the UKCP, this was several years ago now, 7 years ago, and UKCP did a piece of research asking psychotherapists what they would like the organisation to do in relation to psychotherapy and research. And one of the things that came up, which I was kind of a little disappointed about when I saw the findings, but I thought, now this is really interesting because we can only ask for what we think we know. We can't ask for things that we don't know, if that makes sense. Yeah. And so I think it's really interesting that when asked what do you want from research, people ask for the things that they knew that research might be about. Yeah. So they said, oh, well then maybe we need to know more about effectiveness and outcome stuff. Yeah. Maybe we need to know about, some of the client-based stuff like the diagnostics of client behaviour and so on. so you can see where I'm kind of going, nobody's asking, and then some people then thought that actually it would be nice to know about different research methodologies. Yeah, in other words, they're saying, I really don't know what I don't know here, and I think I'd like to know. Yeah, but I think one of the things that can happen around research is because we have a particular view of research, would you agree, that it tends to be more quantitative? Yeah, it's a bit like 9 out of cats research, or show us what works, yeah, rather than what is the experience of research, of psychotherapy on people. But that was just really interesting in terms of what practitioners often think they want from research.
Actually, quantitative, in my experience, has been very in medicine, company-based or drug-based or equipment-based. And if you're in a center where you're doing only reconstruction and you're using certain clips or certain equipment, then obviously you will have 100 or 1,000 or 10,000 of those, and out of that maybe so many will be affected with infection or other things. So that usually comes from companies, and it is actually very targeted as marketing. And the qualitative comes in from the clinical practice. If I'm doing, I have been working on clefts and palates and so on. There's this thing that intermarriages and the lunar and the solar eclipse have an effect on it. So I made a questionnaire, and all the moms and dads were made to fill it. And there was an equal presence of intermarriages and non-intermarriages. In fact, the intermarriages had less of clefts than individuals who did have them. And it was 100% on the lunar eclipse and the solar eclipse. They were doing something or the other related to cutting. And there were other things, they have little tags and all. They were sort of making knots and threads for stitching or whatever. So that has been 100. So that qualitative exists. And many things out of qualitative research, it comes out to give you the correct picture. And so, questions like, what are the chances of so many women having cancer out of so many? Obviously, in a center of cancer, so many came and so many had cancer, so 1 out of so many. But if you see patients across the board and you're just sort of counting the numbers, then the one who gets the cancer is 100% cancer. And the one who doesn't get it, 100% she doesn't get it, or he doesn't get it. So it's the perspective of your research which matters. So in my practice, I would say the person who gets it, the one who doesn't get it. And so, qualitative is very much personal experience based.
But we almost have to understand the different research perspectives to know what we want. I mean, I think that was one of the things that was a little disappointing, in terms of the questionnaire. For me personally, that went out, where people weren't asking for, the stories or case studies or whatever. But, it kind of, people got caught up in that therapy as drug model, which is effectiveness outcome stuff.
I think most of the questions that have been going around here in just our discussions what came up, you can't even answer them in a quantitative way, right? It's actually impossible. It can only be done in a qualitative way. We also know that there is a lot of questions for those who consider themselves true scientists, right? Of what you already said about the worth of qualitative research, right? They always put that large question there. I think too there's a lot of questions how on earth can you ever, answer answer that in a quantitative manner.
And quantitative is very agenda based.
Very much.
I remember in the NGO that I worked with 20 years back, I came across this young lady from Cambridge who was conducting a research on violence against women. And I was just, she came to our center and she said, she was asking questions from our advocates, and I said, so is it lack of education? Is it, I was very eager to find out how the West is seeing violence against women, and over here it is very rampant. She says, you'll be surprised, it's across the board. It's there, it's here, it's everywhere, and that is what her research was about. I didn't know that. For me, it was just people who are not educated are more violent. That was a very black and white thing for me. It comes because of ignorance. But she said, no, it's very much prevalent in that society, and it's across the board. Educated people get violent, and they take violence, and they are violent with their wives. And the women who are educated, they take violence. There's a lot of shame attached to it. But she was doing it from a legal perspective.
To some it's for pleasure. Displacing the anger. No, actually, what is that called? That's sexual.
BDSM.
Sorry? Sadomasochism. Yeah, that's it.
S&M.
Yeah. Yes.
But I guess what we're trying to do is kind of begin to sort of uncover the stories that breathe life into the work, in fact, that are the work. And we're kind of really looking at this from a practice-based perspective. Practice-based research happens within the practice, within the practice of psychotherapy, where the practitioners themselves are engaged, actively engaged in the research. It's a very reflexive practice, and what that means is that part of the requirement is for the researcher to be very reflective. So it's less about looking out there as this kind of cold observer, but it's a bit like doing what we already do in the work, which is be very reflective. So it's not just me who is doing work to a client, but we know from our many different models that I am in there too. So therefore, that it needs to be very reflexive, to be reflective in that sense. There's a word here about practice-based research that I think is really helpful, and I'll try and find the paper to give to you, but it's this word redemptive subjectivity, which is a kind of a mouthful, but essentially practice-based research gives voices to those who don't normally have a voice. Like so much research is done by white European North American men, and that perspective influences the research that gets done very often.
Even in our Quran, there is so much interpretation of the Quran on women's rights, or laws, Quranic laws pertaining to women, done by male scholars.
Exactly. And redemptive subjectivity is where we go, whoa, please speak. And the work comes from a lot of black African women who have, black African American women who have done a lot of work around hear our voices, this is what it's like. You know, the notion of redemptive subjectivity becomes important when you kind of look at the figures for the number of black people who are in mental health institutions. Yeah, and it's much higher, a much higher proportion. And we have to ask why. And when we begin to notice why, it's because behaviour and so on is judged very often from a white American or, you know, European perspective, male perspective. You know, it was not long ago in the UK where women were kind of sectioned or placed in mental institutions because they give birth to children outside of marriage. They were institutionalised. We know that, you know, I mean, I think now that kind of group of women have now died. But up until not very long ago, there were still older women in institutions who were committed, you know, many years ago because of having babies.
But isn't it like Freud, I mean, just because of World War II and what he went through, a lot of his theories came from his personal perspective too.
Yeah.
Okay? All of them have their own personal perspective.
Exactly. And so when we do practice-based research, what we can do is have this notion of redemptive subjectivity just by giving voice to people and recording their voice. Yeah. Through Richard's autoethnographic work, he gives voice to the life of a soldier in the Falklands. He also gives a voice to an experience of post-traumatic stress. You know, set aside from you know, a clinical approach. Yeah, he brings it alive. Yeah. And so, utilising those research ideas, we can have this redemptive subjectivity. In other words, we give redemption, we give voice to those who have previously not had a voice. You know, a lot of this work, particularly around, you know, psychosis and so on, some lovely work has arisen from spirituality and psychosis. Yeah. If we separate sometimes some of this spiritual awakening, yeah, from a psychotic episode, we miss something important. We just see the psychotic episode and not the spiritual awakening. Does that kind of make sense? So, you know, your guy with a psychosis or whatever has incredible deep awareness. Yeah. You know, if you look at people who have spiritual awakenings, it can look a bit bonkers. Yeah. But, or is it? Yeah. You know, so we have to listen very carefully to the stories that people present. You know, so somebody who's having profound visions and so on, we could medicate them and send them off to a mental institution, or we follow a different protocol around making them feel safe, yeah? Allowing them a space to sleep, yeah? Kind of inviting them not to go into that deep meditation for a while, yeah? Come back down, yeah? And maybe work with the awakening in a different way. That would be one example. Yeah? Rather than this one-size-fits-all, they're having visualizations and hallucinations. Actually, there's a really great film. I probably can't get hold of it here, but if you have an opportunity to see it, it's really good. It's called Crazy Wise.
Crazy Wise?
Crazy Wise. And it's a film that kind of, it is a film about redemptive subjectivity, because what it is, it looks at the stories of people who have kind of major episodes of psychosis and also breakdowns, But in the film, it kind of looks at, it gives a much more kinder view on it. So a colleague and friend of mine, Carol Dunham, who lives in Nepal, she's American, and she decided to go to Nepal because she felt it was a much kinder place to her own shamanic experiences that were a bit mad, you know. She's actually an anthropologist and has written quite a lot about stuff. But she just presents another view. It's a view that's worth hearing. That, like, you know, some cultures, perhaps here once upon a time, would have had a way of dealing with people who had visualizations. Yeah, you know, in most Eastern countries, there's a way of dealing with it. Yeah? In fact, there's often a way of listening to the kind of either visitations that people have had, or the strange dreams they're experiencing. Yeah, that actually, for some cultures, that's a form of wisdom.
It was somebody who came, which was, what was it, Ronick or one of them, and he talked about PTSD.
Mm-hmm.
And he said there was one ethnic community in the US that had very low PTSD, didn't have it. And none of us could guess it. I don't know if you guys remember, if you guys know it. And he said the point is when the Native Indians, the Native Americans come back from war, yeah, remember? They don't treat them as you're going to go back to be normal. They treat them like they have gone through suffering and they need treatment. So when they come back, they don't go home. They don't go into their own little areas. They come together. They all sit together, and then they do this whole, I don't know, experiential, just sit together, you know, let the experience flow out. They take a couple of days to just do that. And they see them as someone who has come back damaged in a way. They don't treat them like, oh, you went to war, you're fine now, you go back home. And because of that, because of their perspective and dealing with it, they don't tend to have PTSD.
The giant.
Yeah, they do all kinds of rituals and stuff.
The evil energies kind of leave their body. That's something like that.
There are a number of projects that begin to do that. Colleague Joe Bobrow in the States, when working with veterans, you know, he invites people, you know, veterans get together in groups, and they do a whole bunch of things, you know, in terms of some fairly, you know, deep rituals, you know, but they'll also do things like eat well, sleep well. They don't do any therapy as such, like we would know. They'll do Tai Chi and they'll go hiking and a whole bunch of things that are around healing it rather than stigmatizing it.
Yeah, so what was your friend's name in Nepal?
Carol Dunham, it's spelled Dunhan. She does a lot of work in Nepal. She does a lot of work, she's an anthropologist, she does a lot of work for National Geographic, and her husband, Thomas Kelly, is one of the photographers for National Geographic. So he's actually done work in Pakistan as well, you know, taking photos of communities. But she does a lot of work on Tibetan Buddhism in some of the practices there, you know, very deep ethnic practices. But her own experience was one of, you know, kind of being a bit of a crazy wise woman, she would say, you know, and so she lives in Nepal and does amazing work with burn survivors, actually, or she did. In a project there, you know, for women who had self-immolated, you know, and so, you know, just work on that, which you're maybe familiar with, Shaista, the self-immolation. But practice-based knowledge is one where we question the academy. you know, and knowledge, you know, so it's a bit like where we say, is that so? You know, is that the best way of practicing? Can I, you know, like it's where we question the figures that are used. We stand up to it maybe, and we say, well, you know, these figures may show that this intervention works, but let me just look at how you did the research. That doesn't apply to me. You know, it's a bit like Shaista was saying in relation to her work, you know, there are some aspects of that research that are really helpful and useful, but actually it also misses a lot of really rich insights. So in practice-based knowledge we do question that. You know, we try to offer different perspectives. Interestingly, it's less research funding driven. A lot of research is done, as you know, by stakeholders, by companies or universities who are wanting funding. So therefore that delivers the agenda of what gets done. In practice-based research, we can do it ourselves. You know, we just need to find a structure for doing it in. But I would argue that in practice-based work, we're doing research all the time. We just don't necessarily have the places to deliver it to. And practice-based research, you know, it validates clients' voices. It gives a voice to our clients in a different way.
So I have, as I'm sitting here, I was thinking about so with research and the problems that may arise with us as therapists using research, because the other day I was also talking to Anita about how I've worked with so many teenagers that it's like I've been doing research, right? Because I'll see a number of them every day and a very specific age group, and how it's almost like there's a script that's slowly developing, and how I almost see that now. It is research based, because I'm working with so many, and then I use one thing that I worked with one client on, and then I try it on the other, and I'm like, oh, this works here. But then there is a certain, almost when someone walks into the room, there is an expectation, there is I wouldn't necessarily say an agenda, but okay, based on my experience, what's the most efficient way to help them? Right? And with research, a lot of times, it is about what is the thing that we can apply on everyone, or what is the thing that we can apply on other people. And then a lot of what therapy teaches is you need to be present, and you need to be in the here and now with your client, right? So on the one hand, we've got research telling us, okay, this is what to expect, this is what to do, and then there's another saying, put all that to the side and just be present. And so when I think about, okay, how do we use the research, even that raises a lot of questions for me.
And when you say how do we use the research, like what's in that question, or what might be in that question for others? Is it, what is the point of it? How can I, what can I do with it? Or what's your question in there?
I think for me, actually asking that, it's kind of just being aware of the pitfalls of it.
Yeah.
That when we do read something,
Yeah.
to be aware, okay, there are many ways it can impact me positively,
Yeah.
but what are some ways where it becomes a subtle way of not letting someone in?
Yeah.
Right?
Manzaro was earlier, I think we were chatting this morning, where I think like a research bias came in there, right? Because again, as I'm sitting here, sometimes, and yes, I've lived here for almost 30 years, right? However, at times where I feel it's something I would really even like to research, right? Because the similarities and the difference even between the cultures and how that impacts even our work as therapists. Sometimes, like yesterday when I was sitting here and some of you were talking about, you know, the religious values and how good they were, and I'm also sitting here like, whoa, a lot of my clients, right? It is those strong religious values that totally bind them and shackle them sometimes that they struggle with, and it's probably the way that those religious values are presented or received or interpreted or lived through the family, and I get that. But then I'm sitting here, then the bias, and that's where I think a bias in research is something that we need to be very alert about, because again, of course, we all bring our own perspective into the research, and knowing that it's the same like with Zara, when we pick something up that is so close to our heart, then it's something that will really come in there very, very strong. And that's where when you say we're writing from our own perspective, however, I think there needs to be a real awareness there too, then how it can be very strongly colored.
Yeah.
Just
So Zara, actually when you're talking of research, immediately your work with the students and all that has been kind of been there throughout. And when you said that there's a bias that comes in and it could be this and sort of the constants that you come across, I think the chart needs to be very open, and every time a new condition or a new situation comes in, then it kind of just enters your chart rather than the chart being in there and here comes another of this category.
Yeah.
So then you keep adding to that chart, and then the age goes this to this, and it's a very open, qualitative research.
Yeah, because I mean, like, because there are times when because I then question myself, right? Like where I will be sitting with a person or with a student, and I will be very present, and I will listen to them, and then I will use words, and I will reflect what they're saying, and literally like 3 hours later, I reflect, and I feel like I'm really present with this other person, and I reflect, and I'm like, wait, that's almost exactly what I said 3 hours ago. And so is it that they are, you know, am I not as present as I thought I was? Have I tested it in my head and think this is something that works?
So that's your new column, and that goes to your supervisor. But you have so much material there, you know, I'm almost wanting to look at it. Yeah, because it's like
So rather than focusing just on this one thing, I'm trying to, let's take some of the principles from this really, and you know, I guess what we're noticing is that there's potentially some material there. There's some material there that's probably there for your supervision, in terms of practice and so on. But what feels more important is this is a practice-based issue,
Absolutely.
and this is the stuff to potentially write about. And one of the things that, you know, like around bias that we can name is, and that I think Anita was kind of saying, is that, you know, we do have an ethics in this research, you know, and part of those ethics, I think, is to be very clear and upfront. A lot of the research ethics in relation to, you know, how we present things was named many years ago by a number of feminist researchers who said it is entirely, you know, permissible to talk about from our own experience. You know, as long as we just simply say this is from my experience. The problem with other research has been that it's been said to be objective, when actually, and that was the point of the feminist agenda, was that like, actually this is a question of like, redemptive subjectivity in that this is not about women's voices, this is about men's voices, you know. So one great researcher called Carol Gilligan wrote a book called In a Different Voice, and she kind of opened up some research, and it was very lovely work that somebody called Lawrence Kohlberg did around moral development, and his work was really very important. You know, but what Gilligan argued was that the scale of Kohlberg's moral development model favoured men. Yeah, but it was taken as a universal idea. Yeah, and it favoured a male perspective because, like, the people on this scale of from kind of being very rule-driven and punishment-driven, that's sort of on the bottom end of the scale. You know, it's if you make moral decisions, if you don't do something because you'll get told off. Yeah, that's a kind of a lower level. That's kind of what children do, you know, like you can't, because cognitively they don't have the capacity to reason. That comes from the work of Piaget on, you know, on child and cognitive behaviour, that like when you're a little person, your brain's not developed enough. So it's a bit one of the reasons why you can't say to a 2-year-old, don't do that, because if you do that, then that's going to hurt so-and-so. And that will be very difficult for them. You can't do that to a 2-year-old, because morally they can't at that stage think about the world from the other person's perspective. What they understand is, that's bad, I get told off. Does that make sense? Mm-hmm. Yeah, so that's a very, you know, so like on a scale of moral development. But he had many other scales of development, and the kind of the peak of development, you know, people like Gandhi would sit on the top, people like Martin Luther King. You notice there's not a lot of women on that top. And actually, what Carol Gilligan argued is that, well, women, and this is a bit kind of, you know, broad brushstroke, but what she invited was that women, when they make decisions, are much more relationally orientated. Yeah. So a woman may not make a decision based on, well, let me just helicopter above this and make some. Let me just think this through. You know, what is the best way of doing this if I take that principle and that principle and that principle? You know, a woman's perspective is much more likely to think about, oh, how will this impact on Miriam? Let me just think about how, if I do that with Miriam in relation to so-and-so, that will be a bit more difficult, yeah. So, you know, the peak of a moral development, that's being able to detach yourself and detach your feelings from a decision, don't necessarily work from a woman's perspective. Yeah. So what she said was that, like, this is a lovely model, but it's skewed, and it's supposed to be objective, but it isn't. Yeah. And much better to say for Lawrence Kohlberg to have begun his work by saying, I am a white American man. Yeah. And this is the research that I have done. Yeah.
But that's so true.
Sorry?
It is true, isn't it?
Which
white,
bit?
I mean, if it's a white American man,
Yeah.
say, doing his research at 40 or 45, it will be very different to a white American doing it at 18.
Yeah.
And likewise, there will be a lot of similarities of a similar person who was doing it in the East.
Yeah.
And then women do have a different way of thinking than men. So all these realities are definitely there.
So part of what feminists argued way back in the 70s and 80s was, you know, that an ethical perspective in research would be to describe who you are and where you come from.
Exactly.
Yeah.
What was the name of the book?
The book was called In a Different Voice, and it's by Carol Gilligan. I think it was written in the 1980s.
And then there's a third gender, the hermaphrodites, the ones I've worked with quite a bit. And there we have a bit of a man and a woman. they're strong and yet emotionally kind professionals, and whatever they do well. And they are not recognized at all internationally.
Now it's getting there.
No, those are transgenders, they're very different.
I mean, there's an interesting research thing around what is the experience like being you? Is one way to add to the academy. Yeah, that's the bit about the practice-based research. Yeah. Does that kind of make sense that we begin to kind of utilise what's here and bring it up? Yeah. Just quickly go through this. This work is, there are several writers who I think have been really important. Polkinghorne is one. He's written quite a lot about humanising research. In other words, just questioning. He wrote quite a bit about developing in-practice judgment within healthcare, and in other words, by kind of really inviting practitioners to use the work that they do in the field, to invite deeper learning of practice as a whole. Donald Shon, some of you may be familiar with, he's done a lot of work around training, and actually a lot of trainings are based on the kind of the learning cycle that Shon developed, which says, that you come into class and you do your learning about things, and then you go out and you practice it, and then you kind of go, actually that theory is kind of nice in principle, but it doesn't work in practice. So I have to redevelop my understanding of that theory, yeah. So I bring it back into the classroom, and then I maybe learn something else. And can you see how when we develop our teaching and our learning as practitioners, it's a mixture of what we learn in class and what we learn in practice. It's that thing. It's called inductive and deductive learning. So the inductive bit is what I learn in class, and then there's the other learning that comes through experience. Yeah, so
it's like action research?
Yeah,
Exactly. Action research?
Exactly. So action research is a really good example of that, which is where we kind of look at what it's like in practice, yeah, and then how that then reinforms theories and so on. Yeah. So that notion of like, we're just not empty vessels that receive the teachings, yeah, and then that's it. What this research asks is that like we receive knowledge and then it becomes ours. Yeah, so as practitioners, it's like I am a mixture of a number of theories, for example, but I do my therapy nowadays as Jan Moyser. I can tell you a whole range of mentors and individuals that I've had, but it's not exactly what it says in the book. Yeah, and that's that whole bit about, and we'll be noticing about in-practice judgment. Yeah, it's based on my inner knowledge. Yeah, my developed inner knowledge, and that's what we're giving precedence to. Yeah, not what's given to me externally alone, but what I've learned in practice.
But then don't you need a supervisor who understands that? You need that. In a way, we're going rogue in so many ways. Then you need a supervisor who understands that it doesn't have to be so black and white, right?
Yeah. Well, I think that is true, and that's a question of a more developed supervisor. But this notion of going rogue is an interesting thing. And again, it's what we talk about when we look at in-practice judgment. you know, it's a bit like if you're using a if you're in the left-hand column of therapy as drug, you know, where you do a prescribed thing, when it's therapy as dialogue, it's based on what's here. Yeah. And part of what we're looking at as independent practitioners is, like, we might use that phrase going rogue, and I quite like that actually, you know, but it's not as if it's based on nothing. It's actually, we're giving value to the practitioner's knowledge, yeah, and we're not giving precedent to the expert above, yeah.
So but then the rope definitely gets shot down for quite a while.
Yeah.
Until they're able to actually see it.
Yeah.
But I guess this qualitative research again is basically also sharing that, how it works for me.
Yeah.
So if I've gone rogue and you're going to shoot me, but I have an evidence to show this is how it's working for me.
They will have
Exactly,
it. That's
exactly.
why important.
Yeah.
It's like, you know, when you give that example in the first Microsoft thing, how you took your client for a walk. That really, right, has resonated with other people because, you didn't, should you? No, because I've done something like that. That's why, but we had talked about it, that's why I'm bringing it up.
But you know, it's like, but what we can notice is that like your, you know, one's in practice judgment might be to just, let's experiment with this. Let's take a walk outside. You know, let's just sit in the open air and listen to the sounds. You know, we already now know that there is a school of therapy called ecotherapy that actually says, and it works with all the evidence, that actually being outside is really healing and important.
Would that be classified as body-mind because this person was having problems with the legs and so on and they walk outside and just walk?
Well, you know, this is where I am inviting all of us here to develop that in practice judgment.
But at that time, my do's and don'ts were not so developed and clear, so I instinctively thought I could do it.
Yeah.
But now I would think 10 times maybe, because now the ethical framework, not now, but after that, was clearer, and it was like, why did you feel you have to do that? And those questions didn't come into my mind at that time, because I was very new to this, and I thought this is something I want to see for myself. He says he limps, and he's sitting with a very tilted posture. And when we were walking, he started walking like a normal person, no limp and no posture was straight also. So there was something happening, and in the course of that walk, a lot came out. And I think the relationship of trust began because he felt that I have walked with him, and I have seen him as an equal, not as a doctor or as a special person who can heal him, but as a person who can be a companion. So sometimes, you get I get a little confused about the do's and don'ts of therapy.
I think a lot of us do, because we often have this great big, professional member body that kind of tells us, it is like this, but our experience may say, but it isn't like that. Yeah, and I think this is the sticky path when you're an independent practitioner. And that bit about going rogue is really important because, it's not as if we're saying anything goes. It's not as if I'm saying, well, I'll just go for a walk with my client because I think that would be a really nice thing to do when we're mates, or I can't be asked to kind of do any deep work today. It's not that. Yeah, can you see what we're really trying to develop is a strong inner ethics of working. And we can begin to do that you know, by even, I think there's a great research project around what happens when I'm caught with the do's and don'ts. You know, how do I develop my work when there is all these do's and don'ts? Yeah. You know, what we do know, and again, you know, for many years we've talked about the impossible profession. You know, and it's an impossible profession because there is a multiplicity of ideas about how to do it. And what we're doing is, and this is where I really hope you get a sense of where this becomes really important when we